Good morning, everyone. Welcome and thank you for joining us. I'm Cassandra Williamson-Hopp, the Conference Editor of Benefits Canada, and your host for today's webinar. With the impact of the coronavirus being felt across the nation, what key policy issues should be top of mind for Canadian insurers, and what impact could these have from a private payer perspective? Further, how has the pharmaceutical industry mobilized during the pandemic? This morning's webinar, sponsored by Amgen and Innovative Medicines Canada, will address these questions, as well as cover the proposed Patented Medicines Pricing Review Board reforms, the value of Canada's dual coverage system, and the most recent private drug plan cost drivers report. Just a few housekeeping notes before we get started. This is an example of an attendee interface. You should see something similar on your own computer desktop in the upper right-hand corner. Please use the orange arrow to open and close your control panel and the audio tab to select your preferred audio, either mic and speakers to use your computer audio or telephone to dial in using the information provided. If you have any questions for today's presenters, please type them into the questions pane of the control panel. You can send in your inquiries at any time. We'll be collecting these and addressing them during the audience Q&A session at the end of today's webinar. To begin, let me introduce you to today's presenters. Pamela Freilich, President of Innovative Medicines Canada, and Joe Farago, Executive Director of Private Payers and Investment at Innovative Medicines Canada. Without further ado, I'll hand the mic over to you, Pamela.
Thank you very much, and it's a pleasure to be here. This virtual reality is a little bit different for presenting, but hopefully everything goes well and we all walk out of here an hour from now a little further ahead than when we came in. We know that there are some policy issues on the minds of Canadian insurers and are very, very happy to be giving you some updates and just some insights into some of those key issues. So thank you, first of all, to Benefits Canada for providing that opportunity to us, and of course for Amgen as it's our very generous sponsor of this particular session. And we know that the time is short. If ever there's anything we can do, please reach out to Joe or myself for more information. You can follow me on Twitter, reach to me on Twitter at PCFreilich, or of course via LinkedIn. For today, in just a couple of moments, there are three areas that I'd like to comment on fairly briefly. One is really about innovation and the intersect with the pandemic that we find ourselves in today. How do those two mix and mingle? Secondly, to talk about some of the initiatives that our members have taken on throughout the pandemic that I think would be of interest to you. And then thirdly, I'll do some high-level comments about the regulatory environment that we're finding ourselves in, and which is having an impact on everything this industry does, including during the pandemic itself. We'll make sure that we keep some time for Q&A at the end. I will be passing on to Joe Farago, as mentioned. Joe is our Executive Director of Private Payers and Investment, and he's going to go into much more detail on some of these policy issues that we wanted to speak about. So point number one for me is around the innovation intersect, and especially at a time of a pandemic. And there are three words that drive this industry, and they are testing, treatment, and vaccines. The other word that I would throw in here is collaboration, because that for me is a theme through all the work that I do, not just during a pandemic, but certainly it has been absolutely crucial during this time of COVID-19. And we have seen unprecedented levels of collaboration. And by this, I mean across the pharmaceutical industry itself, through the various companies, between this industry and governments, other stakeholders, patient groups. It is such a global issue. It affects absolutely every one of us. The only way that we're going to see ourselves through this is to collaborate, to share information, and make sure we get to some solutions as quickly as possible. So there is an awful lot of work still to be done, and I know you're hearing updates on this on a daily basis. There are some glimmers of light at the end of the tunnel that give us hope moving forward. As of April, we know that 70 vaccine candidates have been identified around the globe that are being worked on that could lead to the vaccine that we are looking for. There's a great example, by the way, of this work going on in Canada with one of our companies based in Quebec, Medicago. They were able, in fact, to identify a candidate vaccine within just about a few weeks of the virus arriving in Canada. It's almost unprecedented. You may have some sense, I guess, of just how difficult it is to create a vaccine. And in fact, in some cases, we are still seeking that vaccine. I think of the world of HIV/AIDS, where decades later, we still do not have a vaccine. although we do have very potent treatments that allow people to lead a very normal life. But in terms of the work we're doing now, we're definitely trying to accelerate as much as possible. And the fact that a Canadian company is part of this mix, more than one company, frankly, but that we can bring together all the pieces, the players, the stakeholders that are essential to finding this solution, should give everyone a little bit of hope. In terms of treatments, there are, as of the end of April, 139 unique treatments that are currently being investigated. And Health Canada, in fact, for here in Canada, has approved several clinical trials to see if these may be as effective as we hope they will be. For instance, Eli Lilly is partnering with a Vancouver-based technology. It's a biotech company, AbCellera. And you probably have read a bit about this in the press, but they are looking at blood samples from patients who have already recovered from COVID-19. They want to isolate some naturally produced antibodies that can then be used for treatment and prevention. And of course, a lot of work going on in diagnostics as well, the testing issue that we hear so much about. So again, testing, treatment, and vaccines are the order of the day in terms of the intersect of this industry, the innovative world that we live in, and the pandemic. The second item I wanted to speak to briefly is what is the pharmaceutical industry doing at this moment? How has it mobilized to fight COVID-19? It's a global effort. There are domestic efforts going on, but certainly we've really have counted on the efforts going on around the world. And the word collaboration, once again, is a theme throughout this. The WHO launched a project called ACT. It's Access to COVID-19 Tools. It's an accelerator fund, again, to bring all the right players together to make sure that we are as speedy as possible in coming up with best solutions for COVID-19. The industry is a founding member of this particular coalition. And I would have to say that that could be seen as a silver lining to all of that's going on within this pandemic, that often industry, not just the pharmaceutical industry, but industry and government, there can be tensions. This is one of those times where the value of all players is being recognized. And so for our international body to be a founding member of that WHO initiative is extremely instrumental. Of course, what's driving all of the work we do is patients. This is our starting and end point, our motivator, our driver in everything that this industry does. It is the health of patients. They are dependent upon these medications. It really drives all that we do. And of course, some Canadians may lose access to their drug benefits as a result of having lost their job through COVID-19. So well, we think that may be fewer than we're originally imagining. And I'll just do as a sidebar comment, the Conference Board of Canada has come out with a report just in the last few days, you'll probably find it on their website, that tries to quantify the number of Canadians who are falling through the cracks in this way. Our members are providing, and they always have provided, some compassionate access to medicines. These programs have continued. Some of our members have introduced new initiatives in response to the pandemic itself. So for example, Amgen, our sponsor here today, and Ipsen, another of our member companies, are making sure that patients continue to have access to the treatments they need. They're providing medicines free of charge to patients in Canada who are currently prescribed the company's medications and who have lost that coverage due to the pandemic. So that is just one example. Do feel free to check our website, innovativemedicines.ca, where we are keeping track of all of the initiatives being offered by our companies. If you or someone you know feels that they might have need to this kind of a program, make sure you speak with a healthcare professional who will help them identify what is available to support them. Another way that our members are helping out during the pandemic is freeing up their staff, who are healthcare professionals in many cases, and they are being fully salaried but allowed, encouraged to volunteer on the front lines of working in the pandemic. So that's a key contribution. And the other thing that we've done, in addition to the individual company efforts here domestically in Canada and globally, is the members of the association have pooled money to create a special COVID-19 fund. And with that, so far, we've been able to purchase 100,000 N95 masks. We all know how much in demand they are and how difficult they are to find. It wasn't an easy task, but we managed to bring 100,000 in and to provide them to the Public Health Agency of Canada to make sure they got into the right hands. And then as a second stage, we discovered that our our colleagues in the pharmacists profession are struggling to get PPEs as well. And so we managed with the Canadian Pharmacists Association to purchase 200,000 surgical masks, and they have all been distributed across the country as well. The other thing I'm very proud of with our members is that you're not going to see headlines on the work that's going on behind the scenes. You may see the odd comment here or there, but our members are not doing this for the credit, for kudos, for the headlines. They're doing it because it is the right thing to do. The third item I wanted to speak to, and it's a segue into some of the items that Joe is going to be talking about, is to really touch on some of the current regulatory challenges that we're experiencing. And these predate COVID-19, but they certainly still exist throughout this pandemic. So as you know, innovation is the very essence of what we do. But we are a business, and so we need the right environment. We need a viable business model to be able to function in any country, and that means getting a balance between cost containment actions, the price of drugs, as well as the regulatory framework which oversees the industry itself. Unfortunately, there are some changes that have been passed into law. They were passed in August 2019. They have not been implemented yet, but they have been passed. And so with the information that is available, analyses have been done regarding the impact of that particular regulatory change. There's an independent firm, PDCI, and I think you were just going on to that slide, Joe. You might have backtracked a little bit. There we go, right there. And they have, again, used the information that's available to us to estimate the impact on the industry, and it's going to be significantly more than what has been projected from Health Canada. You can see the discrepancy, the 8.8 billion from Health Canada through their cost-benefit analysis back in September 2017. Of course, many things, even in their own regulations, have changed since then, but the current analysis is 41.8 billion. So there's a very large discrepancy that needs to be addressed. That's in net present value, NPV, and over 10 years, I might add. And so this translates into between 70–80% reduction of the bottom line for many of our members. And as you can imagine, it's impossible to sustain a business with that kind of a drop in revenue. But more important, I would say, than focusing on the impact on individual companies is the impact on patients. Because as the environment in Canada has been and continues to be so uncertain for this industry, global decisions are being made around whether or not to bring drugs to Canada. Obviously, it's a labor-intensive, time-intensive, dollar-intensive industry that requires a great deal of, well, time and money to bring medicines to the table. And so industry does need to recoup its investments. And what we have seen, again, in this uncertain environment, but in particular, in terms of new drugs being brought to Canada, we looked at the time period from August 2019 to the end of that year, so Q4 of 2019, when these new regulations were announced. And we now noticed, I should say, that 44% fewer new drug submissions came to Canada in that time frame. And that's compared to the same period in 2018. It was 30% fewer than the same time period in 2017 and 16. The one other statistic I'll cite for you is clinical trials. Of course, clinical trials are often the last hope for patients who are suffering from very serious illnesses. And there, the data show in Q1 of 2019 a 50% drop in clinical trials starting in that time frame compared to the previous 3 years. So it isn't a single blip in the data. The companies cite to us ethical concerns because, of course, if they bring a drug into Canada in a clinical trial and it's no longer then available to them because of the regulatory environment, that just would not sit well with anyone. It just goes against all the codes of ethics that we abide by. So the implication of all this, one piece, I should say, that I'll leave you with on this regulatory front. Again, Joe will get into this in a little bit more detail. But the regulations have not have not been implemented yet. That date is July 1st. So that's only 49 days away because of the pandemic. The emergence of the guidelines, which will tell industry how to apply, how to comply basically with the regulations, have not been issued in their final form. So as an industry, we're not sure quite what we are to do with that timeline. We have asked federal government to suspend the implementation date by at least 6 months to not only allow for the guidelines to emerge, but also for all of the member companies of Innovative Medicines Canada to be able to comply with what is expected of them. So there are significant hurdles that we're facing, I should say, in this particular environment. We're not alone in it. You'll notice from the slide that you're seeing in front of you that one of the many organizations, patient organizations that are concerned about this regulatory environment is CORD, the Canadian Organization for Rare Diseases. They have been relentless in their approaches to government, trying to help them understand that, in fact, the current situation is not tenable. Fight for Our Lives is the name of their campaign. You can see it on the banner there. And there are many other groups, of course, that are carrying that same message. An e-petition has been launched. You can find it on the internet. It has over 10,000 signatures and is open until May 20th. Again, this is to just suspend the implementation date. The regulations have been passed. We acknowledge that. But to make sure we get it right in this country and not just fast. So the final couple of comments I would make before I pass over to Joe, again, when Canada does prioritize the life sciences sector, it benefits not only our economy, but also the quality of life, and most particularly for the patients who need the medicines that we need to make sure continue to come to Canada. I'll end on the same note that I've mentioned throughout these brief remarks and at the beginning, is that collaboration and partnership is what's going to allow us to arrive at the best decisions, whether it's around a response to the pandemic or a response to these regulatory reforms. So thank you for the listening for these last few moments. Again, feel free to reach out to me on Twitter at PC Freilich or on LinkedIn. And for now, I'll just turn over to Joe Farrago, who's going to review and highlight some of the pieces that I talked about earlier, the value of Canada's dual coverage system for you, and some of the policy issues that might have an impact. Joe, over to you. I can't hear Joe.
Joe, we can't hear
That's
you.
what happens when you don't turn off
There
your
you
mute,
go.
folks. So
Thank you,
you
Joe.
figure after about 1,000 calls, I'd get this right. I guess not.
The new
So
norm.
I want to make the T-shirt that says "You're on mute," because we're all saying that more than anything these days. Thanks, Joe.
we need big signs. So thanks, Pamela. That was excellent. I think it sets up really well the points I want to cover with those on the line. So what I want to do is first take a look at what does this mean for the private market, and why should those of us that have employer-sponsored health benefits care? As Pamela highlighted so nicely, the proposed changes potentially will have significant impacts on drug access, not only for those with public plans, but of course also those with private plans. And one of the things we know about private drug coverage is one of the key values it provides is typically faster and broader access. Now, often I get asked, well, do you have any examples of where there's a link between lower prices leading to lower access? And the answer is that yes, we do have some examples of this. Okay, so I wanted to give a few global examples to illustrate the relationship between countries that have higher prices and lower prices, and see how their access looks like. So this data is from 2011 to 2019. And what it does is it looks at the availability of drug launches within those countries. So we'll start with our neighbors on the left side of the slide to the south of us, the United States. They undoubtedly, we know they have the highest drug prices in the world, and they've had access to 87% of all new drug launches. Across the pond over to Europe, and we go to Germany, which traditionally has had higher drug prices, and they had access to 63% of all new drug launches during this time period. And we go down to the southern part of the globe. We see here with Australia, which typically has lower drug prices, and they've ran around 39% of new drug launches. To South Korea, lower drug prices, only 35% of all new drug launches have made it to South Korea. Interesting, South Korea was one of the countries proposed by the PNTRB that would be included in the basket of countries that we would be compared to. It subsequently has been taken off the list. And lastly, you'll notice New Zealand on the far right. It's not being mentioned publicly too often anymore. It was one of the countries that was touted as having low drug prices, and during the pharmacare debate was mentioned quite a bit. It's since fallen out of favor for the simple reason, as you see, New Zealand has only had access to 20% of all global drug launches. So the bottom line is there is a balance between prices and having access to future innovation, future cures, and treatments. Okay, now I want to show some new data, which I just recently had the pleasure of seeing in the last few weeks, coming from IQVIA. And IQVIA, for those of you that don't know, is one of the largest, well, it is the largest data source for analytics on the pharmaceutical market and the business in Canada, the sales data, what's happening within the market. And one of the things they showed is looking at drug launches in Canada since 2009. And the one thing to note is that launches of drugs are a very good indicator of whether companies are bringing drugs to the Canadian market. And on the far right in blue, we see that in 2019, we saw the lowest number of new drugs coming to the market since 2011. 17 new drugs were actually launched in Canada in 2019. And it's the lowest number we've seen for many years. So, we have to ask ourselves, why do governments implement new policy? What's the problem that's trying to be solved? You would think with all the noise that's out there right now that this one would be targeting the price of drugs. And over the next few slides, I want to show you some data looking at, well, what are we looking at when it comes to the price of drugs, specifically in the Canadian market? Okay, so I'm going to take a look at total healthcare spending, and this is for all of the healthcare system, public and private, and what's the share related to drugs. And this data is from 2007 to about 2017, which is the last data set that we have available. The blue bars, and I apologize, I tend to show a lot of data to kind of make my points and to help give you some facts and figures to some of the points I put across. So I'll try to walk you through what are the salient points and what all these lines and bars actually mean. The blue bars simply represent the total healthcare spend in billions of dollars in Canada. And we can see at the time of this data set, 2017, it was at about $235 billion. And the question I always get asked is, we hear about drugs and taking a larger share of healthcare spend. And most people are surprised when I say, well, actually, that's not totally true. It's not true at all, in fact. The top line in orange represents the share of the healthcare budget in Canada that is related to all prescription drugs. And as we can see, for the past decade or so, it's been hovering around or just below 15%. It hasn't changed. If you take a closer look at the line in purple, which represents the share of spend that's related to patented medicines or branded drugs, we can see that since 2010, when we had a patent cliff, when there were a lot of generics that entered the market, we saw that overall branded drugs represent less than 7% of the total healthcare spend in Canada. And in fact, this number has been very consistent. So drugs are not taking a larger share over the overall healthcare budget, nor are they growing faster than other healthcare spends we have. And in fact, if we take a closer look at more recent data from Canada on what the healthcare budget is being spent on and what's growing, just a few more figures for you here. Drug spending in the middle, it grew in 2019 at 1.8%, which was less than hospitals at 2% on the far left, and about half as much as the growth seen in costs for physicians. So what we clearly see is that drugs are not taking a larger share of healthcare dollars. So people say, well, why do we get more focus on drugs than the other components? It's quite simple. It's very difficult for governments to close additional hospitals. We have a lot of hospitals in Canada. It's not very popular nor very practical to be closing hospitals as well. You have physicians, nurses, a lot of healthcare staff. Cutting additional healthcare staff is not popular either. And so clearly, one of the things you can look at is, well, can we do something with regards to the medicines that are being used to treat patients? So oftentimes, drugs is one of the areas that's looked at, but clearly the data shows that it is not growing faster than the overall health spend and is not growing faster than some of the other costs that are in the system. Now, more specifically, if we take a specific closer look at the price of drugs. So again, I'm going to walk you through this because I know it's a lot of numbers here. So this looks at the price of the drugs that are regulated by the PNPRB, which was mentioned by Pamela. This is the body in Canada that regulates drug prices, and this is since 2011, 2018. Direct your attention to the yellow bars on the bottom, and that looks at measuring how does Canada's drug prices compare to a basket of countries that the government uses to compare our list prices against. And we can see that, in fact, 2018, the list prices for patented drugs in Canada was actually 21% below the median, the countries we compare to. So the data actually shows that branded drugs, which are significantly regulated in Canada, are entering the market below the comparative countries that were being used by the government. So as I said earlier, we need to think about the purpose of a policy and what are we trying to achieve to ensure that we're not causing harm to patients, but also that we're not causing harm to an important industry for Canada, which provides a lot of resources and funding for the life sciences sector, which actually helps to drive innovation and find new cures and treatments. Now, talking to a group within the private market, so I also wanted to look at a little bit in terms of what's the sense in the private market when it comes to the affordability of drugs. And I wanted to just highlight some research that was conducted for CLHIA by Abacus, and it asked Canadians, what's your opinion on the affordability of the medicines you take? And it was found that 86% of Canadians with private coverage, in fact, said that the medicines they take are indeed affordable or affordable enough. If we look to the far right in orange here, we see about 15% with private coverage that are having issues. And I would argue this is the gap that needs to be looked at in terms of helping these Canadians out. Now, this generally tends to lead to a discussion on pharmacare and what are the gaps that are there, but I don't plan on getting into that today. But clearly, these gaps that we're seeing, whether it's on the public system or here in the private system, we believe can be addressed by building on the strengths of the dual market of a public-private system that is in Canada. Again, it comes to identifying what's the issue that you're trying to address with any policy. Okay, so now I do want to shift gears a little bit and talk about the private market. And specifically, I want to draw your attention to the comparisons between private drug coverage and public drug coverage and some of the significant differences. So on the right-hand side, we have a value proposition for the public plans. And some key differences exist. Typically, public plans are set up to serve older populations. And traditionally, public plans are in the business of rationing public resources. They have finite budgets, and they're trying to ration these resources. Now, on the left-hand side, the private plans, I would say the value propositions are very different. You know, typically private plans provide faster innovation to keep employers at work, so they're trying to encourage workplace productivity. Younger populations, of course, it's important to limit short-term and long-term disability because those costs, as we know, can be quite high in many organizations. Of course, this supports revenue when you keep employees happy and productive. Now, the one similarity between both of these systems is they both can and do negotiate prices with manufacturers. But as you can see, there are a lot of differences between the left-hand and the right-hand side of the screen. So private plans don't look like public plans, nor should they. Now, today I am happy to give you a preliminary glimpse of some new research that we've conducted looking at the private market compared to public plans when it comes to timely access in Canada. I've been in this role for 4 years, and I often get asked, do you have any data showing how long it takes private plans to list new drugs versus public? And unfortunately, my answer up until now has been there's almost no data. We know they're faster, but we don't know the exact numbers. So this new data, which is not published yet, you're getting a first-hand glimpse of this, we see that private plans are much quicker at listing new medications. And on average, in this data set, 47 days on average versus public plans, which take almost 2 years, so 632 days to get a drug listed. Now, that doesn't mean the drug is available. We're talking here about the drug being listed on the public or private formulary, okay? It's important to note that for many new specialty drugs currently entering the market, we are seeing that it can take significantly longer, especially if they're going through the insurer's health technology assessment. This can add as much as 9 months to the access to these medications. This data also doesn't take into account what happens if the drug has a prior authorization or approval process. That also will take time for a plan member to get access to the therapy, okay? So with all this said, though, private plans today still provide more timely and broader access to innovative therapies. What we don't want to see is private plans starting to look like public plans and taking longer and longer to bring new medicines to plan members into the market. This would erode, I believe, a key value of the private market in Canada, which is ensuring timely access to new therapies to keeping employees happy and productive at work. And I know many cases of individuals who have private insurance who've spoken to me about a drug which has been made available on the Canadian market, and they're still waiting to access the therapy. And these are not all expensive products. So I think it's important that we preserve one of the key values of the private market, which is ensuring the right drug for the right patient to keep them at work and productive. So to end on this section in summary, in terms of the impact of the pricing policy reforms, clearly what we're seeing is significantly longer wait times for new medicines to come to Canada. New medicines may not be launched in Canada at all, and there already is some evidence of that. Less access to medications in clinical trials for hard-to-treat conditions. Many of you may have seen in the media medication that was used for cystic fibrosis. Patients are speaking very aggressively with government, saying we want access to this life-saving medication. We need access. Unfortunately, given the environment that's been in Canada for the last little while, that company didn't even complete trials in Canada because they didn't believe that they could get the drug reimbursed. And there is a global standard that if you cannot get access for a drug in a country, it's actually unethical to commence trials in those countries. So the good news is this company is now looking at having conversations with payers to see about getting this drug and making it available to Canadians. So some good news there. And lastly, as I mentioned, the value of having private drug coverage, the coverage itself being eroded over time is one of the impacts. So in summation, reduced access to innovation is a risk, and therefore reduced productivity and revenue for the companies that are paying for these health benefits. I spent a fair bit of time looking at the costs of healthcare on the public side. I want to take a little bit of time and look at the overall cost within private health benefits and the breakdown. And again, this is one area when I talk to people that aren't familiar with this data and I ask them, well, what percentage of the total dollars paid out in private health benefits you think are related to drugs or some of the other health benefits? This always surprises them. So not surprising anyone, we know drugs are the largest paid out health benefit at $11.7 billion. This comes from the CLHA fact book in 2019. But close behind that, we have dental coverage, which is at $8.5 billion, and all paramedical services at $3.9 billion. Most people are quite surprised that dental is so high. And I think it starts to lay the groundwork of take a holistic view of what's being paid for, what's being spent, not only within private drug coverage, but even down to the plan sponsor level. What are you paying for? What's driving the cost within your health benefits plans? And there's some new research which recently came out that I wanted to share with everybody on the phone. Most of you probably not have seen this. And this was published in Canadian Health Policy back in March. And what they did is they want to take a closer look at the individual health benefit costs within the Canadian market. If we take a close look at the breakdown, we see here that the first bar, which is dental plus vision and other, is at $11.9 billion. Combined, these are as large as prescription drugs and the distribution fees here in blue, second bar from the right at $11.9 billion. However, if we just look at dental alone, which is in orange, we see, and this data is from 2017, so it's a little bit lower than the previous slide. We see dental as $8.3 billion. And if we go to the far right, we look at, this is just patented medicines. And the reason we separate this out is that patented medicines are the drugs that are being talked about the most when you hear of sustainability of private plans, controlling drug prices, drug costs. It's always focused on patented medicines, not generics. And we see here is that patented medicines are at $6.2 billion. Actually, dental is 25% larger than the cost spent on patented medicines in Canada. This data comes from CIHI and PNPRB, so it's not industry data. It's actually coming from the government that tracks these numbers. Now, more interesting, when you take a look at the growth rates, what's happening, what's growing. This is again from 2007 to 2017. We see that patent medicines are actually growing at the lowest rate. It's also important to note that of all the benefits by far, drugs are the most regulated in health benefits. There's been a lot of emphasis, and I think the insurers have done a very noble job of trying to control costs, implementing a lot of tools and strategies for plan sponsors. They are definitely the most regulated. The question is, how does that compare to all the other health benefits being paid for? So, taking a holistic view, it's important to look at all the cost drivers in a benefits plan. And I would argue it goes beyond health benefits when it comes to employer costs, and also includes things like short-term and long-term disability, especially given the overall growth rates that we've seen in recent years for drugs, which have been in the low single digit. Again, they may surprise people that the overall private market in Canada is growing in the low single digit when we look at actual numbers. And that's kind of what I want to spend the rest of my time talking to you about, is looking at some research which was done from the recently published 2019 Private Drug Cost Drivers Report, that's a mouthful, which looks at the growth rate in Canada's private drug market from 2016 to 2018. So for those not familiar with the report, this is the largest analysis of the cost drivers of the private market in Canada. It was born a few years ago out of the desire. We really wanted to understand what's driving growth within the private market and spend. Is looking at the data going to help people manage their expenses better? And I believe the answer is yes. Now, the report can be found on the Innovative Medicines Canada website, and simply going to the Better Access, Better Health website. That's a component of the IMC website. If you have any challenges, by all means, connect with me on LinkedIn. I'll send you the report. I'm fairly active on LinkedIn and often publish on matters related to market access, health, and medicines as well. So let's get into some of the details here. I have one slide on methodology and data sources, and I'm not going to go through the slide. There's only 2 points I want to stress, is that the data that was used for this report represents 82% of the paid direct private drug claims market and captures over 13 million active claimants with over 130 million claims. So this is a very robust, and it is the largest data set of its kind to do this analysis that's been done. Now, as well, I'm going to start with the main points from the report. The report is about 60 pages long. So in the next 4 or 5 slides, you're going to get all the key points from the report, but I would encourage you to go to the report and look at least the key summary sections that are included in the report. So overall, right and square in the middle, the growth rate that was seen in the Canadian private market was 3.5% combined annual growth rate. That was the overall growth from 2016 to 2018 in the Canadian market. The first point I'd like to highlight is that utilization accounted for 88% of the growth, excluding Ontario, so from the rest of Canada. And I'll explain why Ontario was pulled out separately in this slide or so. Second point, chronic diseases represented 86% of the growth nationally. We hear a lot of talk at conferences and events about chronic disease and the impact on employer health, et cetera. It remains one of the key drivers of costs within the private market. Thirdly, OHIP Plus and generic price reductions did help offset growth over this time frame. Fourth, drugs between the price of $10,000 and $25,000 accounted for 50% of the growth. However, this growth was driven by, again, utilization. And you're going to see that word come up more often as I go through the next couple slides. Now, the top 4 classes of drugs that were used were biologics for autoimmune disorders such as arthritis, Crohn's colitis, etc., diabetes, cancer, and other autoimmune drugs. Those are drugs that are used for MS, for example. And lastly, no surprise here, the age group that drove most of the costs were those employees between the age of 45 and 64. They accounted for 50% of the growth that was seen in the private market. So no surprise here. Now, one of the items that is included in the report is the comparison of the actual growth rates that are part of the cost drivers analysis and comparing that to the insurer projected trend factor for drugs. And as we can see here, that the trend factor has been running in the double digit for many years now. And when we take a closer look at the comparison of the actual growth rates versus the Buck Trend Survey, which is where these trend factors are reported, we see a 3 to 4-fold difference between the real growth rates in the market and the projected trend factor. So I think after several years of comparison, it's safe to say that the trend factor, it shouldn't be looked at as a projection of the real growth rate of drug costs, but more of as a starting point. The way it's been described to me, it's kind of like the sticker price of a new car prior to negotiating the final price, or in this case, prior to an advisor negotiating the increase in premiums. And you'll note that if there's a figure on one of the slides, it actually correlates to the actual figure that's in the report. So you'll see these if you go back into the report. Now this slide simply summarizes the overall results and gives you a better idea. So what are these cost drivers I've been speaking of? This is how the report's broken down. There are essentially 4 things we look at. Cost per claim, which is in orange. This can be attributed to being driven by the cost of new drugs entering the market. The cost per claimants on the bottom here, which is at 1.7%. This is being driven by 2 things. One, the far top left, the number of new claimants entering the market. And we will see here from 2016 to 18 is very low compared to historical at 0.1%. And this can be attributable to market events, which I'll get into in a sec. And then we have the claims per claimant. So how many more claims are these claimants making? And it was 1.6%. So what we get is cost per claim at 1.8, cost per claimant at 1.7, and this gives us that 3.5% combined annual growth rate I was speaking of. Throughout the report, we tend to focus on 3 things. The cost per claimant in orange, and the far left, the 2 blue items, the number of claimants, and the claims per claimant. You can consider anything you see in blue relates to increased utilization, driven by more claimants making more claims. So often we get asked, so my drug bill is higher. I say, well, is it because you have more employees making more claims, or is it because you're using more expensive drugs? Very important to understand what's happening with your drug costs. So let's look at some of the other details that are in the report. Now, one of the variables we had to better understand in this year's report was the impact of OHIP Plus program in Ontario and the overall growth rate. So for those of you on the line that are not from Ontario, OHIP Plus was a program that was introduced whereby young adults under the age of 25 were shifted from their private plan to the public plan. So for those that didn't have private coverage, you now had coverage, and for those of you that are on private, you were forced to switch to the public plan. Midstream, the new government that came into power then had those plan members go back to their private coverage. And what we see here is that the growth rates in Ontario were very low over this 2-year period at 1.3% because we had a number of claimants. So we had the claim effect dropping way down, and we saw 1.3% growth rate. Nationally, 3.5%. The rest of Canada grew at 5.1%. And this gives us that overall growth rate, as I mentioned. Now, the report has additional data in there if you really want to look at it in terms of what happened to Ontario specifically. And we see that the number of claimants clearly dropped out of the market, and therefore the claims in Ontario significantly were reduced for last year. And we are predicting in this year's report, excuse me, we should see a bit of a rebound as these claimants now have re-entered into the private market. Interestingly enough, we don't believe that all of them came back. Some of them stayed within the public plan. So, but you'll have to wait for next year's report to see exactly what happened. Now, this next slide shouldn't surprise anybody. When we took a closer look at the impact of chronic disease drugs, we see they play a significant role in the overall growth rate. And they accounted for 67% of the share of drug plan costs. And actually, 86% of the overall growth nationally was driven by chronic disease meds. And as in with previous reports, it highlights the importance of really better understanding chronic disease, or as I like to say, chronic disease load being experienced by a plan sponsor. So when people ask me, what can we do to reduce our drug costs? So, well, a safe place to look at is chronic diseases, especially those that are driven by lifestyle choices. We have, as part of our new report coming out, we decided to take a closer look at patients that have multiple chronic diseases and how many drugs they're on. And one of the things it's showing is that people that have more than one chronic disease are using a much significantly greater share of the private health budget. Therefore, if you get these people healthier, you're going to end up in the long run reducing your overall costs. And I know that the insurers have responded and are trying to come up with very innovative solutions around improving wellness programs to being more outcome-based. So wellness programs that make people feel good. I know a lot of companies in the past use a lot of these. More and more we're seeing to outcome-based wellness programs that are trying to make people healthier. And this is one of the reasons why, because chronic disease doesn't seem to be going away. Now, additionally, the report also looks at which disease states are driving growth. And what we can see here, and this shouldn't surprise too many people that have looked at the market. Number one, we see that biologics for autoimmune diseases accounted for 47% of the growth. So of that 3.5%, 47% of that growth rate was attributable to biologics for autoimmune disease. Now, at the bottom of this slide, what you see here is what's driving that growth rate. And you can see here that 92% of this growth was driven by increased utilization, which is why it's in blue. Second and third drugs were diabetes and cancer. These grew at 32 and 24% respectively. Here we see that the increase, 51 to 59% of the increase was due to the cost per claim. And here we have newer drugs which are replacing older drugs in the diabetes market. And in the cancer therapy, we have new drugs that are entering to treat cancers. Again, it's being driven by the cost of the claim. And lastly, the other immune functions. Here, these took 12% of the growth. And what we see here is that 58% is due to increased utilization. Okay, 3 slides left for you. Hopefully the numbers haven't been too much. Hopefully I'm making sense. So one of the questions I get asked and hear a lot about is the growth in specialty drugs. Specialty drugs technically are any drug that costs over $10,000 per year. And what the slide shows us, I'll point you to the second bar, for drugs that are between $10,000 and $25,000, typically that's where those biologics are fitting in here. And we see that out of the 3.5% growth rate in the report, 1.9%, over half of it, is due to drugs between $10,000 and $25,000. Okay. Now, when we take a closer look at what's driving this growth, if we look at the cost drivers specifically for this group, what we see here is that, again, I may have messed up on the slides here. I apologize for that. We see here that the growth in the drugs over 10,000 is actually being driven by increased utilization. So 84% of the growth is because you have more Canadians with private drug coverage using more biologics. Okay, and this really is not a big surprise because in Canada we have a higher prevalence of autoimmune diseases. And Canada, in fact, has one of the highest rates of MS in the world. And in addition, Canada has one of the highest reported prevalence and incidence of irritable bowel disease in the world. And a lot of these diseases end up being treated by using biologics. So there may be a reason why we're using more of these drugs in the Canadian market. So I think one of the things that Pamela stressed in the beginning of her presentation was it's imperative that policymakers find the right balance between prices of medications and value they provide in order to ensure Canadians have access to medications in the future. And so these are some few key highlights I want to leave you with. Secondly, that innovation is key to new discoveries of important medicines. And never has this been more important as today when we're trying to race to find new treatments and vaccines for COVID-19. I think this has really highlighted the importance of governments and industry working together to find important treatments in times of crisis. We saw that the actual drug cost growth has been in the low single digit for several years now, and that utilization continues to be the main driver in the growth we're seeing in the drug costs within health plans. This simply refers to the value of private plans, providing more timely access to new medications, especially when compared with public plans, which, as we saw, were much, much slower in giving Canadians access to new therapies. One thing we just recently talked about was that employers should focus on chronic disease, working to reduce overall disease load of plan members as one strategy to help lower long-term costs of health benefit plans when it comes to utilization of drugs. And lastly, hopefully I've convinced you that it's important to take a holistic view of health benefit costs in order to better understand what's driving health benefit premium increases. And on that note, I'd like to thank you for your attention, and I will pass it back to Cassandra.
Thank you so much for your insightful presentation, Pamela and Joe. I'd now like to open up the remaining time we have to address some questions from our live audience. And the first question is for Joe. Define or help us understand what a drug launch is. Does this mean a drug developed in the USA is launched all over the world or just specific countries that pay? I don't want to assume the simplicity of the term drug launch.
So a drug launch refers to a drug which has been in Canada, specifically in Canada. So a drug that has been submitted to Health Canada and received its regulatory approval, so its notice of compliance. And from there, the company decides to commercialize it and is available to Canadian patients. So it could be the case where a company will get its notice of compliance and decide not to launch in that market. So a launch refers to the drug being available to Canadian patients. And typically in Canada, it's seen as it's an important market for the global pharmaceutical industry, but it's not the first market that is being launched in. Typically, drugs will get launched in the US and then parts of Europe, and then the Canadian market is considered.
Great, thank you, Joe. And our next question is for Pamela. Have clinical trials stopped due to COVID? Pamela?
Sorry, yeah, I'm just making sure that I'm unmuted and visible. Thanks very much. Sorry, have clinical trials stopped because of COVID?
Yes.
I think that was the question. Yeah, not completely, and I don't have data in front to tell you what the percentage might be, but certainly we've been hearing from a number of companies that are trying to do clinical trials. It's extremely difficult to do clinical trials in a world of pandemic, not just in Canada, but around the world. Trying to make sure you have a sterile, safe environment for patients to come and to be part of such programs, just the one example. So the quick answer is to say that they have definitely slowed down. They have not stopped at this point in time, but significantly more difficult to conduct them during a pandemic.
Thank you, Pamela. Our next question is for Joe. Joe, do you feel that plan designs that introduce wellness programs that are outcome-based and additional holistic paramedicals will move the focus from utilization of chronic drugs and might reduce future spend on drugs?
Over the last several years, it comes up all the time, the wellness programs. And my personal view, and speaking with plan sponsors and advisors, is that historically, you saw a lot of wellness programs that were put in place because it seemed like the right thing to do. They improved company morale. They showed that the employer was interested in the staff. But in terms of what was the outcome, I think the overall resounding verdict was that they didn't do much to improve overall employee health. So I see that there's a greater talk and a shift to saying, okay, if we're going to invest, and it is an investment by plan sponsors, right? If you're going to invest in a wellness program, to challenge your advisor or your insurer to say, I want something that's going to make my employees healthier, whether it's a mental health strategy, whether it's a chronic disease strategy, and therefore you should be able to measure it in terms of, are my employees healthier and what's the impact on productivity? And in Canada, unfortunately, we don't see a lot of research and analysis on what's happening with employees once they're healthier in productivity. Intuitively, you would think, well, it's a no-brainer, Joe. If my employees are healthier, use less medications, you would think that everything else has improved. And I think that it's a very positive trend to drive to wellness programs that focus on outcome-based results when it comes to employee health, whatever it is, whether it's a chronic disease, whether it's a mental health. I don't talk a lot about mental health drugs because by far most of those drugs are low-cost generic products. However, the impact of mental health on short-term and long-term disability is staggering for many organizations. So I definitely see a trend, and I encourage everybody who's a stakeholder within the private market to be innovative and come up with programs that can help plan sponsors better manage the actual health of their employees. And one of the things we see constantly, most people on the line may be familiar with the Sanofi survey, and one of the things that comes out is that employees are very willing to participate in health programs like this. And actually, there is a significant portion of employees that have an expectation that employers actually take care of their health. So I think the market is ripe and employees are ready for the next phase. Helping your employer manage costs to make you healthier, I think it's important given the growth rates we're seeing across all the health benefits today in Canada. Sorry for the long answer.
Thank you, Joe. Our next question is for Pamela. Will PMPRB consider not going ahead with the new reforms, or is it already decided that they are going to go ahead with it, but it might not be until July 1st?
The regulations have been passed. That happened in August. And so reforms will take place. The question that we're confronted with right now is how will the regulations be implemented? There's a fair bit of leeway, flexibility as to how the Patented Medicine Prices Review Board will actually implement the regulations. Think, if you're familiar with bylaws of an organization, they're very high level, and then the organization determines through its day-to-day policies how they are implemented. So it's somewhat similar to that. So the PMPRB has been in a consultation process since after the election in the fall, the federal election. Draft guidelines were circulated. They solicited commentary from anyone who wished to provide it early this year. And the situation we're in right now is we're waiting for what we've been told will be a secondary sort of mini consultation on the revised guidelines. So at the moment, these guidelines are to come into play at July 1st. The problem is, as mentioned, that the PMPRB had its consultation process intercepted by the pandemic. So we don't know what they are coming out with as their revised guidelines. There has not been this mini consultation on it, and yet they are to be implemented on July 1st. So our push is to, at this point, suspend implementation because we just don't feel that there's any way the industry can respond appropriately and comply. And then that will allow the secondary consultation to take place. So we hope to have more impact on what ultimately will be put into play whenever, in fact, the guidelines are implemented. So, thank you.
Thank you so much, Pamela. Unfortunately, that's all the time we have for questions. Thank you all for such an informative discussion. I'd like to thank our presenters once more, Pamela Freilich and Joe Farrago, for sharing their mornings with us today. And I'd also like to thank our sponsors, Amgen and Innovative Medicines Canada, for their support and hard work leading up to today's digital event. And thank you to everyone for tuning in. When you exit today's webinar, you'll be prompted to answer a survey. We'd appreciate if you took the time to provide your honest feedback, as this is integral to the planning of future webcasts. Have a lovely afternoon, everyone. Stay safe and look after yourselves and loved ones.
Thanks, everyone.
Thank you. Be safe, be healthy.